concern globally due to its health and social impact. Alcohol use is known as top 5 risk factors of disease and disability. Prevalence of alcohol use among adolescents in the United States is 63.2%, and among them 32.8% are current drinkers. In Malaysia, despite lower prevalence of current alcohol use among adolescents, there is increasing trend from 5.6% to 8.9% based on Global School-Based Health Survey 2012. Alcohol use among adolescents can give rise to serious health effects such as alcohol intoxication, alcohol dependence, liver cirrhosis, cancers, and neuropsychiatric conditions such as depression and anxiety. Alcohol use contributes to death of young people as a result of motor vehicle accident, homicide, and suicide. Alcohol use exposes adolescents to risky sexual behavior, unintended pregnancy, and sexually transmitted disease. Alcohol drinking below age 15 years old can lead to alcohol dependence in later life. Previous studies on factors associated with alcohol use among adolescents in Malaysia does not include mental distress factors and religious factors. Therefore, it is useful to carry out this study. The finding in this study could help healthcare providers, teachers in greater planning and implementation of alcohol intervention program by identifying the target group and its associated factors. Objective is to determine the factors associated with alcohol use among schoolgoing adolescents. Specific objective to describe the characteristic of participants involved, to determine the association between current alcohol use and health risk behavior, association between current alcohol use and mental distress factors, and association between current alcohol use and religious factors, and association between current alcohol use and parental monitoring factors. This is my conceptual framework. My dependent variable is the current alcohol use among adolescents, while my independent variable we divided into category into social demographic factors, health risk behavior factors such as smoking, drug use, sexual intercourse experience, school truancy, physical fighting, mental distress factor, depression and anxiety, and protective factors, parental monitoring, parental supervision, and religiosity. This is a cross-sectional study conducted between May and September 2013. Involved secondary school students from 18 districts in Peninsular Malaysia. A total 40 secondary schools in Peninsular Malaysia were randomly selected in this study. The participants involved were Form 4 and Form 5 students, and respondents who did not complete the questionnaire related to alcohol were excluded in this study. The instrument used is the self-administered questionnaire based on Global School-Based Student Health Survey and Risk Behavior Surveillance System. The result. This is the characteristic of the students involved. Majority of the participants were 16 years old. Percentage of male and female participants are almost equal. Majority are Malay, and prevalence of alcohol drinker among adolescents is 11.7%, and prevalence of current drinker is 6.1%. Among them, 64.4% male and 35.6% female. 38.2% start to drink alcohol before 14 years old. And majority of the adolescents who drink alcohol get the alcohol from family. But by very analysis, all the factors independently significantly associated with current alcohol use, except for the poverty level. All the health behavior, all the parental, all the mental stress factor and parental supervision factor and religious factor are all significantly associated with current alcohol use. In multivariate logistic regression for factors associated with alcohol use among school-going adolescents, the factors that significantly associated are the ethnicity, which is Chinese ethnicity, current smoker, current drug user, school truancy, and mental distress factor, which is feeling loneliness, and religious factor. Okay, for discussion, The prevalence of current alcohol use is lower compared to United States and Thailand. And current smoker is associated with 4 to 5 times higher risk of using alcohol compared to those non-smokers. And drugs use are associated with the increased use of alcohol compared to non-drug user, consistent with the study done by Yusuf et al. 2014. School truancy may increase accessibility of adolescents to alcohol by buying from shops or from older peers. This will ultimately lead to school dropout and behavioral problems such as alcohol and drug use. Adolescents who has mental distress such as feeling of loneliness and having sleeping problems have higher odds of alcohol use compared to adolescents who never experienced it, consistent with study done by Augustine 2009. And lack of religiosity were associated with current alcohol use among adolescents, as supported by Thunder et al. 2009. Parental monitoring was not significantly associated with alcohol use among adolescents in this study, although many studies found it is the important protective factors. Conclusion, the prevalence of current alcohol drinker among adolescents in Peninsular Malaysia was 6.1%, whereas the prevalence of ever drinker alcohol was 11.7%. The factors associated with alcohol use were Chinese ethnicity, current smoker, current drug user, school truancy, and presence of mental distress and lack of religiosity. So targeted intervention focusing on the above factors is pertinent to in reducing the prevalence of alcohol use among adolescents.
Okay, thank you. So you have 3 minutes for Q&A.
Can I ask about religious? Sorry, twisted. Yeah, can you explain a bit more about the religiosity? Because it seems that Chinese and Indian are not religious, right? If you see the results.
There are actually 3 questions related to religiosity.
What are the questions like?
The first question is, did you agree about religious is important as a guide in life? And the second question is, did you agree about the
You're finding the questionnaire now, right?
Do you agree to ensure your life does not conflict with the religious belief?
Okay, the third
The third question is, do you agree that religious education is important in your family?
So these 3 questions can determine whether the person is religious or not. In adolescence. Ken, are you sure? I'm just asking. You are the expert, so just tell me. I don't know. Are you sure that these 3 questions can really, show that a person is religious enough, especially at a young age like this?
I think because I only have these 3 years old.
Yeah, I'm just asking your opinion. I'm sorry. If you ask your kids, 3 questions like this, can you say that they are not religious, or if they disagree, they are not religious? Or if they agree they are religious? I'm just asking you. That's why. Just your opinion. I know this is not done by you, but because this is taking from the IKU, right? Yeah, IKU data. But I think you should ask this, when you receive this kind of data, okay? Because you want to imply that when you are not religious, you are more likely to be alcoholic. But here your question is like only 3. How can we be sure? Because there are so many religiosity questionnaire, for Muslim, from Christian, for all other religion, So maybe that is a better way of assessing them. Okay. Thank you.
Okay, I think we already